Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Thursday, January 28th, giving you the update from Albany Med. All right, let's pop open the first graph. This is the Capital Region, people admitted to the hospitals in the Capital Region, and there's currently 503 on today's report. The high water mark was 553, so
That's
clearly
right.
going in the right direction.
It absolutely is, Dennis.
Next graph here are admissions and discharges. This is just the medical center. Now this graph only shows things from the first week in September. Maybe next week we should show the full year again, but this is only over the last 4 months. And you can see admissions and discharges are about the same, although some days having more discharges than admissions, which is great news.
That's right.
And on the below the graph, you have green for people who are discharged, black for people who have died in the hospital.
Right.
It's a good opportunity for us to remind ourselves that the mortality rate for people who are admitted to the hospital is about 14%.
That's right, Dennis. It's not insignificant. It's a very large number.
So, obviously despite heroic efforts and everything we can do, there's obviously some people who the virus will.
That's right.
Okay, and then we talk about the morning census here at the medical center. So we currently have 130 in the hospital who are diagnosed with COVID, 23 in the ICU, 8 on a ventilator. Now, Fred, going back to that top number, 130 in the hospital, we've talked about this in the past. There are people who are still in the hospital who are still positive for COVID, but they're no longer infectious. What is the number within that 130 that fills out that group?
So, Dennis, this morning that was 45. So that's 45 people who are still testing positive for COVID, but aren't infectious. We're probably measuring dead virus. In that group, they break down to about 20 that are waiting for nursing home placement, and they have to be negative before they can leave the hospital and go to the nursing homes. And the others still have acute medical issues. They may have ongoing respiratory issues not related to COVID, or frankly, they may have other things that brought them in and they happen to be COVID positive.
Right, a car accident, tested positive.
Exactly,
right.
Exactly. So flip it around a little bit. We have 85 active COVID patients in the hospital today.
Very good.
That's another way to look at it.
That is a good way to look at it, and we'll from time to time remind ourselves of that number. Let's shift gears and talk about vaccinations for a second. Fred, I'm going to go through some numbers here about vaccinations because I think they're quite interesting. So New York State data, if you look at the first doses, so we know that both vaccines require a first dose and a second dose.
That's right.
They're allocated separately. In New York State, there's been a total of 1.3 million doses given to New York State from the federal government for first dose. And so far in New York State, 1.25 million of them have been given. So that's 96%.
That's pretty good.
Which is remarkable. If we go inside the Capital Region and we look at both first dose and second dose together, we're actually quickly approaching 100,000 doses. We're at 95,611 doses given, which is really remarkable work. And then, as you know, Fred, the skilled nursing facilities have contract pharmacies which are coming in doing that vaccination. The good news there is 82% of the residents in those facilities actually have been vaccinated so far. So that's quickly approaching a very high number as well.
That's going to be terrific. That's absolutely terrific.
So we've talked in the past about a website called capitalregionvax.org. That's the website that was built here for the Capital Region Vaccine Network. On the top of the page, there's a link there for the COVID-19 Vax dashboard. If you're like Fred or I and you like to dive into the numbers, it's there, and that link is provided directly from the state. So people can look at those numbers, and they get refreshed on a daily basis, which is great news.
You know, Dennis, having 100,000 residents of the Capital Region vaccinated, that's about 10% of our population.
It is.
So that's terrific, and that's higher than the national average.
It is. Now, in that number is some second doses, so that's total doses, but we are quickly approaching a number close to 100,000, which is great. Fred, a couple questions from the mailbag.
Yes,
from the mailbag.
That's right.
So let me put you on the spot here. The news talks about the variant strains. We know there are a couple different variant strains out there. Let me ask you 3 specific questions about the hospital's preparedness for this. First of all, how are we preparing for any variant strains?
Dennis, we're prepared by doing the exact same things we've been doing for the original strain. So precautions on those patients that are positive, PPE being used appropriately, masking, hand washing, social distancing, all the things that we've been doing. So in a way, think universal precautions
Right.
regardless of strain.
Excellent. Okay. Are we watching for the variant strain?
So the Wadsworth Laboratory is the laboratory locally that
Right.
has the ability to do the genetic testing.
Right.
So we, as well as other hospitals in the regions, are sending them samples so that they can look to see if the strain pops up.
Now, we heard a couple weeks ago, of course, about up in Saratoga.
That's
Have we
right.
heard any recent news about any other variants?
Actually, we've not, Dennis.
No.
So we had a couple up in Saratoga, a couple in Warren County, and frankly, we've not heard anything in the last 2 weeks.
Okay. And are we treating anybody for the variant strain? The answer is obviously
No.
no. But if we did have somebody diagnosed with the variant strain, would the treatment be any different?
At this point, the treatment is the same for the variants that
Same.
are out there.
All right, very good. Another question, Fred. If you've had COVID, how long does the natural immunity to that last? I think we've spoken about this in the past.
We have. We talked about an article from the La Jolla Vaccine Institute out in
Right.
California where they measured a couple of different components of immunity. And it seems to last about 6 months.
Right.
At least that's how long the study went on.
Right. And the question, of course, would be if you have had COVID in the past, should you still get the vaccine?
Absolutely.
Absolutely. All right, very
Absolutely.
good. Fred, a lot of members of our workforce here, we're over 85% now have received the vaccine, at least the first dose. Many are now getting the second dose. Those who are waiting to get the second dose have heard about the experience of some people who've already received the second dose, that they got low-grade fevers, muscle aches, fatigue.
That's right.
Some people have reached out to us and said, you know, I'm worried about getting the second dose. Should I still get it? So you have a journal article that you'd like to talk about that talks specifically about the safety of the vaccine.
That's right, Dennis. So this is another JAMA brief report,
Right.
And it comes from the CDC. And what they did was they looked at the incidence of anaphylaxis, which is the most serious allergic reaction.
Right, I was going to say, for those who don't know, anaphylaxis is severe allergic reaction.
Severe, the most severe.
The throat could swell.
That's right.
Etc.
You need to get epinephrine
Right.
or an adrenaline injection to treat it. So they looked at the first 1.9 million doses
Oh,
administered in the United States, and there were 21 episodes of anaphylaxis. So
Okay.
extraordinarily small number. No one died.
Right.
4 of those individuals were treated at the site and released.
Right.
17 went to either an emergency room. A couple
Right.
got admitted for 24, 48 hours. But they've all gotten over it and
Right.
have done fine.
So that data certainly would suggest that while some people are experiencing some symptoms with the second dose, and not everybody, some
That's
people
right.
have none.
That's right.
It's still a incredibly safe vaccine.
Absolutely. Particularly if you go back to what
Right.
we were saying about the mortality
Right.
of the disease, when you play the odds, it definitely is in favor of getting the vaccine.
Fred, let's end on another good news story. So we have an incredible transplant program here. We talked, I think, in the past about our kidney transplant program, which has been rated among all the programs in the country to be #1 in the past as far as survivability after getting a kidney transplant. I think one year we slipped to #2 or 3, and we wanted to get back to #1. But it's clearly a world-class kidney transplant program.
That's right.
They've done some things recently that are pretty remarkable.
They have, Dennis. So hepatitis C is prevalent in the community.
Right.
It's estimated that 3% of the population
3%.
is hep C positive. And hepatitis C can cause liver disease, cirrhosis, cancer, et cetera. So it's not something to be messed around with. So donors that are hep C positive
Right.
have gone by the boards, haven't been used. Those kidneys haven't
Right.
been used. Recently, I think we've discovered that if you use a donor kidney from a hepatitis C positive patient and treat the recipient with the drugs that we have
Okay.
that treats hepatitis C,
Right.
that they don't get hepatitis C.
Incredible.
So we have actually changed our policies here at
Right.
the medical center, have incorporated a new protocol so that we can use hepatitis C positive donor kidneys. And we've actually transplanted a few people already.
This is remarkable. So it increases the pool of
Absolutely.
kidneys. More people can get the transplant, and it sounds like it could be done safely.
Absolutely seems to be done safely.
Well, we have an incredible team. We thank all of them out
Yes.
there who are part of that. All right, I think those are the topics for today.
They are.
All right, that was a good 9 minutes. That was good. Maybe, I'm guessing about. We'll be here this weekend working the whole team, obviously, around the clock. That's what our team does. We thank them for being here 24/7. And we'll be back again next week. All right, very good.
Sounds good.
We ask that you once again, please take care of yourself, take care of each other, and we'll see you next Tuesday.